Hey everyone, and welcome to the PPCB Prep Guide, the place where we make tricky pharmacy concepts super simple. So today we're tackling a big one, HIPAA. We're going to cover all the key definitions you gotta know, look at some real-world pharmacy situations, and I'll even give you a few memory tricks to really lock this stuff in for your exam. All right, here's what we've got on deck today. First, we'll hit the fundamentals of HIPAA and PHI. Then, we'll get into what exactly counts as protected info. We'll talk about the minimum necessary standard, super important. After that, we'll cover what this means for you every day in the pharmacy, and finally, wrap it all up with the key things you absolutely need to remember for your test. Okay, let's get right into it. Section 1, HIPAA and PHI fundamentals. We're going to break down the core concepts you need to know. So, HIPAA. It stands for the Health Insurance Portability and Accountability Act of 1996. And here's something you might not know. HIPAA wasn't originally all about privacy. Nope. Back in '96, its main job was actually to make healthcare claims easier and, cut down on all that paperwork. The whole privacy part we think of today, the privacy rule, that actually came a bit later to handle the new challenges of electronic health records. And that brings us to the star of the show, PHI, or Protected Health Information. This is the stuff HIPAA is designed to protect. And the magic word you have to remember is identifiable. Think of it this way. If a piece of health info has a name tag on it, if you can trace it back to a specific person, then boom, it's PHI and it's protected. Okay, so this is a really important distinction. On the left, you've got identifiable information, data that can be linked straight to a person. That's protected by HIPAA, no question. But on the right, you have de-identified information. This is where all those personal details have been stripped away. You can't tell who it belongs to. And because of that, it's not protected by the privacy rule, which is why it can be used for things like public health research. All right, Section 2, identifying protected information. So we keep saying identifiable, right? Well, what exactly makes information identifiable? Let's break it down. Okay, get ready to circle this in your notes. 18. This is a number you absolutely need to know for the PTCB exam. There are exactly 18 unique identifiers that officially turn regular health info into PHI. Just one of these is enough to make it protected. All right, let's look at the first batch of these 18 identifiers. A lot of these are pretty obvious, right? Names, phone numbers, emails, social security numbers, no-brainer. But some are a little less obvious, like geographic identifiers smaller than a state. Why? Well, imagine a tiny town. If you know someone's zip code and their rare medical condition, you could probably figure out who they are. Same with ages over 89. It's such a specific group that it becomes identifying. And then, of course, you've got your medical record and health plan numbers. And here's the rest of the list. This is where it gets a little more techy. We're talking account numbers, license numbers, even vehicle serial numbers. Your IP address when you log into a patient portal? Yep, that's one too. Biometrics like fingerprints and voice prints? Absolutely. And a big one in a pharmacy setting, full-face photos. That last one is a catch-all. Basically, any other unique number or code that could identify someone. Okay, let's move on to Section 3. And this is a big one, folks. The minimum necessary standard. If you remember one core principle from today, make it this one. It's basically the need-to-know rule of HIPAA. So what is it? It's the principle that you should only use or share the absolute minimum amount of PHI needed to get the job done. That's it. So before you share anything, you should always be asking yourself, do they really need to know all of this? Or can I give them less information and still accomplish the goal? And this quote sums it up perfectly. It's not about locking information in a vault and never letting it out. It's about being smart and responsible. You share what's needed for that specific purpose and nothing more. It's all about limiting the exposure of that patient's private info. But like with many rules, there are some key exceptions you have to know. The minimum necessary standard doesn't apply when you're talking to another healthcare provider about a patient's treatment. It also doesn't apply when you're giving the information directly to the patient themselves or if the patient has specifically authorized the disclosure. And finally, if the government, like the Department of Health and Human Services, requires it, or if it's required by law, the rule is waived. Okay, let's get into the nitty-gritty. Section 4, Permitted Disclosures and Pharmacy Confidentiality. This is all about your day-to-day responsibilities behind the counter. All right, here is a must-know acronym for the PTCB, TPO.
treatment, payment, and healthcare operations. Seriously, burn this one into your brain. These are the 3 main buckets of reasons why you can share PHI without needing to get a patient's special permission first.
This table is a fantastic cheat sheet. As you can see, for TPO, treatment, payment, operations, you don't need patient authorization. Same goes for disclosures to public health authorities like the CDC or FDA, or to law enforcement if they have a court order. But look at research. For that, you almost always need a yes from the patient. Time for a little pop quiz. Let's imagine this. You're in the break room, grabbing a coffee, and you start venting to another tech about a really complicated patient situation you just dealt with. Is that a HIPAA violation? What do you think? 100% yes. This is a massive HIPAA violation, and it's one of the easiest mistakes to make. Just because they're your coworker doesn't give you a free pass. If that technician isn't directly involved in that patient's care, you can't discuss the case with them. Patient confidentiality doesn't stop at the pharmacy counter. It applies everywhere, even in the break room. So how do you stay on the right side of the law? Just remember these 3 simple rules. 1. Always try to speak directly to the patient. 2. Respect their wishes. If they ask you to only call their cell phone, you only call their cell phone. And 3. Securely get rid of PHI. That means shredding labels and any other documents, not just tossing them in the trash.
Okay, we are in the home stretch. Section 5, Key Exam Takeaways. Let's boil everything down to the high-yield facts you need for the PTCB.
All right, rapid review time. First, as a tech, you are what's called a covered entity. You have to follow HIPAA. Second, PHI is any health information that is identifiable. Remember those 18 identifiers? Your golden rule is always the minimum necessary standard. Know that TPO means treatment, payment, and operations. And remember, confidentiality is absolute, even with your coworkers. And finally, properly dispose of everything. Shred those labels. So, as we finish up, I just want to leave you with a final thought to mull over. How are you going to make protecting patient privacy a core part of your daily routine? Because this is so much more than just a test question. It's about trust and professionalism. It's a huge part of being a great pharmacy technician. Awesome job today, everyone. You really nailed this HIPAA review. To make sure it all sticks, go back over your notes from this lesson. If anything was fuzzy, definitely rewatch that part, and try to practice recalling those 18 identifiers every day until it's second nature. If this helped you out, do me a huge favor and hit that like button, subscribe, and share it with anyone else studying for the exam. We're putting out new simplified pharmacy topics every single day to make your prep as easy as possible. Keep up the great work. You totally got this.